Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Shehzad. May I know what brings you here today? Okay. And tell me more. I'm really sorry to hear about it, Mr. Shehzad. I appreciate that you are concerned about your health and you came to clinic for proper treatment. So, Mr. Shehzad, before we talk about management part, I'll ask a few questions to better understand your condition. Is it okay with you? Thanks for your cooperation, Mr. Shehzad. So, since when you're having a fever? Okay. Have you documented a fever? Okay, Mr. Shehzad, if there are any specific timings of fever? All right. And any associated symptoms like rigors, drenching sweats? Okay. Okay. Have you noticed any change of color of your urine? How about your urine output, Mr. Shehzad? Okay, and do you have body aches and muscle pain as well? Okay, Mr. Shehzad, after what time fever and rigor episodes are repeating? Okay. Do you remain well in between these episodes of fever? Have you noticed any impairment in consciousness? Had any seizures? Have you been taking any prophylactic medicine so far? Okay, Mr. Shehzad, have you noticed any bleeding from your nose or skin? Okay. Okay, Mr. Shehzad, if there is any recent travel to malaria prevent area? Okay. All right. Okay, Mr. Shehzad, have you noticed any weight loss? Okay. How about your bowel habits, Mr. Shehzad? Any rash? Okay. If you had any meal at restaurant? Okay. Do you have any bleeding disorder? Okay, Mr. Shehzad, I'll ask few personal questions to better understand. Okay. Do you smoke? Okay. How about your sleep pattern, Mr. Shehzad? Okay. If there is any history of blood transfusion, any surgical history, any splenectomy? If you notice any insect bite? No? All right. Okay, Mr. Shehzad, do you have any throat pain? Pain while passing urine? Okay, Mr. Shehzad, any pain right upper tummy? All right, Mr. Shehzad. I'll offer you few investigations. Okay, like a rapid diagnostic test. Okay, GIMSAS 10 thick and thin film, preferably during fever and rigors. Okay, and complete blood examination. Okay, and blood sugar level and ultrasound abdomen. Okay, but before I order these investigations, let me confirm if you have undergone such investigation so far. So can I check your reports, Mr. Shehzad? Thank you, Mr. Shehzad, 35 years old. Okay, so Vivax is positive. Okay, so Mr. Shehzad, the history you have shared okay, and the question I've asked, and from your report, I came to conclusion that you are suffering from condition, okay, what we call in medical terminology is malaria, okay, and the organism is Vivax, okay. So for that, I'll manage you, okay. I'll ask you for some lifestyle modifications, okay. I'll advise you how to prevent it and some medical treatment as well. So let's first talk about prevention, okay. So Mr. Shehzad, I'll strongly encourage you to avoid mosquito bites, okay, and keep away from rural areas after dusk, okay, and sleep in air conditioned and properly screened rooms, okay, Mr. Shehzad, and use insecticide sprays to kill any mosquitoes in the room, or use mosquito coils at night, okay, and smear an insect repellent oil or exposed parts of the body, okay. An effective repellent is diethyl toluamide, okay, and you can use mosquito nets, okay, and impregnate nets with permethrin, okay. And I'll encourage you to wear sufficient light colored clothing, long sleeves and long trousers to protect a whole body and arms and legs when in the open after sunset, okay. And avoid using perfumes, cologne and after a shave lotion, because these attract insects, okay. And the rate of catching malaria has increased by, okay. And I'll ask you, also encourage you to try to avoid walking, okay. If you used to walk, okay, avoid walking between sunset and sunshine, because they mostly bite between these timings, okay. And being in malaria area, especially during and after the wet season, okay. And prolonged stay in a malaria area, especially rural areas, small towns and city fringes, okay. Yes, and Mr. Shehzad, yes, wearing dark colored clothing with short sleeve shirts and short you should avoid, okay. And is everything clear till now? Yes, Mr. Shehzad. So now let's talk about treatment, okay. So as your lab showed Vivax, okay. So for that I'm prescribing you tablet chloroquine, okay. With the name of Resogen, 250 mg. You have to take it orally with water, okay. So purchase 10 tablets, okay, and take 4 tablets instead with water, okay. And then after taking 4 tablets, after 6 hours of taking 4 tablets, okay, again take 2 tablets, okay. And then 1 tablet twice for next 2 days. Is it clear to you, Mr. Shehzad? Yes, Mr. Shehzad, you need not to be worried. I'll also give you a written prescription for it, okay. And besides that is Vivax and oval can cause relapsing of malaria, okay. So for that I'm also prescribing you tablet Primaquine, okay. It's 14 mg. You have to take it once a day for 14 days, okay, after you complete this course, okay. After 3 days, okay, you have to start at this tablet for 14 days, okay, Mr. Shehzad. Is everything clear till now? Yes, Mr. Shehzad. So let me tell you some safety netting. If you feel weakness, you become short of breath, and fever did not subside despite treatment, okay. And if you notice any decrease your output, any bleeding, your urine is reddish in color, you feel any edema, yellowish discoloration of skin, so seek immediate advice, okay. And you can contact me, okay? Otherwise, you can get yourself admitted in emergency. Okay, Mr. Shehzad, is everything clear till now? Should I repeat it again for you? Okay, Mr. Shehzad, here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. I wish you a speedy recovery and healthy life. And bye-bye.